Hello everyone, in this video we are going to discuss about tetany. Tetany is nothing but increasing the neuromuscular excitability. What causes this tetany is low calcium. Low calcium, that is importantly less ionized calcium, will causes this increase in the neuromuscular excitability and causes tetany. So what is the normal role of the calcium is calcium will stabilize the neuronal membrane and keeps the sodium channels less excitable. So the sodium channels opening will cause depolarization and excitability. So the normal role of the calcium is stabilization of this neuronal membrane and causing less excitability. So the mechanism is whenever there is low extracellular calcium, it causes less stabilization of this voltage gated sodium channels. So they can open more easily and causes more depolarization and more hyperexcitability because the nerves will be excited spontaneously and continuously. So this causes sustained muscle contraction and leading to tetany. So whichever thing which causes low calcium will cause tetany. So there are few conditions where the calcium will be normal, the calcium levels will be normal. Even though the calcium is normal, it causes tetany. That is, increase in the pH, that is especially in the respiratory alkalosis, there will be increase in the calcium binding to the albumin. This will cause less availability of the ionized calcium. So this will cause tetany. And next is hypomagnesemia. In this the calcium will be perfectly normal. Here the role of the calcium is normal. The hypomagnesemia will cause decrease in the parathyroid hormone release and causes resistance. So this will cause decrease in the calcium because the parathyroid hormone will cause hypercalcemia. So there will be decrease in the calcium because of the decrease in the parathyroid hormone release and causes tetany. So these are the two important conditions where the other than the calcium, the role of the other things which plays in decreasing the calcium levels and causes tetany. So decrease in the calcium levels in tetany will cause carpopedal spasm, laryngospasm, which is more dangerous, and perioral tingling. There are few signs which are important, that is Chvostek sign and Trousseau sign. The first sign is whenever we tap the facial nerve in front of the ear, it will cause twitching of the facial muscle. That is a Chvostek sign. And the spasm of the hands and the wrist occurs after inflating the blood pressure above the patient's blood pressure. Patient's normal blood pressure, we will elevate the blood pressure of the cuff by 10 to 20 millimeters of mercury and will keep it for 3 to 5 minutes. And if there is low calcium levels, there will be spasms of the hands and wrist, which is called as carpopedal spasm. So these are the important points in tetany.